My question is to the Minister for Regional Health. Will the Minister update the House on the progress the Morrison-Joyce government is making in rolling out the COVID-19 vaccines to regional, rural and remote Australians, and in particular the effects of the Royal Flying Doctor Service? Thank you.
The Minister for Regional Health.
Thank you, Mr Speaker. I'd first of all like to thank the member for Flynn for his question and compliment him on the amazing service he's delivered to the good people of Flynn over his career in Parliament, 11 years. Congratulations. As you know, in his own hometown in Gladstone, there are 7 different sites, community-based sites that he can get a vaccine at, and his people can. But out in the far west and in other rural and regional and remote seats nearby in Queensland, they would have to depend on the Royal Flying Doctor Service to deliver not only the technology but the vaccine service, and they've been doing a sterling job. In the good member for Leichhardt's electorate, just in the last 3 weeks, 1,400 people have received a vaccine in some of the more remote Indigenous shires. Places like Cowan and Lockhart River and Pomperow, Kowanyama. In the northwest, the Flying Doctor Service turned up to vaccinate many more, and there was a lot of vaccine hesitancy. They brought mental health staff with them, and they had sausage sizzles, educated people and addressed their concerns, and they've gone ahead in leaps and bounds. They've been around the state, Ravenswood, Birdsville, Mount Surprise, you name it, all these remote places are on the plan for the Flying Doctor Service. In the Northern Territory, they're ramping up now to deliver 15,000 vaccines across 172 clinic sites. Now, everyone knows about the situation in the northwest of New South Wales. The good member for Parkes has been at the forefront there, realises how important the Flying Doctor Service is. They're based in Broken Hill, where they have been not only delivering vaccines, they've brought another 8,000 vaccines into the northwest of the state. They have been involved in actually vaccinating themselves, 3,048 people in the last couple of weeks. They flew in advanced teams because they go by road as well as by air. They deliver medical services, dental services, health services, but they've stepped up to the mark and are delivering vaccines in the most far-flung places of Australia. This big, wide, brown land is covered by the Flying Doctor. That's why they have such an amazing rapport with everyone. Look, in Walgett, Wilcannia, Burke, all these places where the outbreak is, they've been involved in all of those, whether it's the point-of-care testing that they've delivered extra shots to Broken Hill or to Burke and Walgett. And in Armatree, they had 40 people booked to turn up, and when they knew it was the Flying Doctor, 198. So, grey nomads, you'll be able to get back out into Western New South Wales. People in Western New South Wales know that the Flying Doctor has your back and you can resume your normal way of life.